Welcome to the Auburn Medical Group live YouTube, where we talk about the discussion on sitting as brought out in an article today that was published. I'm going to look down here at the computer. It was Medical News Today. Not a website or publication I'm all that familiar with. They're referring to an article that was in, you can hear some cooking going on over here. Yeah, just go ahead and do that. Anyway, the article was in Sports Medicine. Sports Medicine, it was actually published very recently, November 30th, and the title of it is Sedentary Behavior and Body Weight and Composition in Adults, a Systematic Review and Meta-Analysis of Prospective Studies. So we'll jump into that in a moment, probably around 2 minutes into the video. Until then, I want to say hi to all the people, because this is a live video. We actually have people who are using the chat function to say hello, like Chrissy Poo and BooBoo Kitty and Sharon Calvert and Lindsay Vaughan and Ju Muke from Brazil, Cheryl McNutt, good day, Brianna McMillan from Arkansas, Bianca Dye, John Baugh, weight gain or weight again. Why, did I write it? Did I write it wrong? I'll have to correct that if I did. Thank you for catching that if I did. All right, and BooBoo's talking about isometric exercise. So, and now we also see some more people. Audrey Bunch is here, and Chrissy Poo's sitting, and Janine Jones is here. So here, I'll read to you. I'm waiting until we get 2 minutes into it because I told people we'll wait until then. In the meantime, I will tell you that Dr. Gawain, drgreenknight.com, put out his blog post on dictation errors, and they're all his own dictation errors. He actually writes them and what they were supposed to actually be. So that's kind of entertaining. And LeeAnn is here also. All right, now we'll get to me actually reading the... So I'm going to, not on Medical News Today, but actually the journal Sports Medicine, reading right from the results and the conclusions. So the results say that there were no significant associations between sedentary behavior, and you guys can read along. It's well, I guess you'll have to do a search for Medical News Today, and then in the article on sitting, find the link to the actual article. That's it's not the actual article, it's the abstract of it that you can find a link to out of, let's see, what was the name of the journal again? Sports Medicine. Okay, so here we go. There were no significant associations between sedentary behavior and any measure of body weight or obesity, with the exception of waist circumference. For the latter outcome, over a 5-year follow-up period, each 1 hour per day increase from baseline to follow-up in sedentary behavior was associated with a 0.02 millimeter increase in waist circumference. And they point out there's a 95 confidence interval of 0.01 to 0.04 with a p-value of equal to 0.001. That means that it's real, but it's small. The odds ratio of becoming overweight or obese was 1.33 with a 95% confidence interval of 1.11 to 1.60 and a p-value equal to 0.001 in the highest compared with lowest categories of sedentary behavior. Okay, so let me unpack that a little bit for you. Odds ratio of becoming overweight or obese was 1.33, meaning 33% greater chance than if there was no change. That would be a gain of 33%. And the p-value of 0.001 tells you that this is a statistically significant occurrence, that it's not just by chance that they came up with this confidence interval of a 33% gain, that it's very much something that if you replicated this study over hundreds of times, you'd get this same result. And then they write in their conclusions, after they say there's a correlation with correlation with becoming overweight or obese. Not just weight gain, but being overweight or obese. And then their conclusion says, this is in the actual abstract of the article, meta-analysis of data from prospective cohort studies showed small, inconsistent, and non-significant associations between sedentary behavior and body weight. Well, just in the results in the same abstract, it's saying that there is a 1.33 odds ratio of becoming overweight or obese. So I can't blame the writer of Medical News Today too much for coming up with a title that says "Too much sitting doesn't cause weight gain," says study, because the study actually did say that in its conclusion. But you have to dig a little deeper looking at it to find out that that's not what the results show. The results, and the author, her name is Honor Whiteman. I really do respect her in going through the article and pointing out that, okay, maybe it didn't correlate with weight gain, but it does correlate with health risks like high blood pressure, type 2 diabetes, heart disease, and cancer. Increased risk of premature death. Their studies are showing links between prolonged sitting, increased sitting, and these disease states. So she does point that out, but then she does pass along what their conclusion says, which, based on what their own results show, I would disagree with that. Okay, so this is where I go to the comments and see what you guys think about all this. So Chris Andrews does chair aerobics and chair yogi. Being disabled, you find ways you can exercise. Absolutely. Somebody who's disabled, you're going to have to do all you can to not be as sedentary, because the amount of movement doesn't come as easily and is not as much a natural part, and there's not as many options for movement. All right, and then looking back at sitting too long kills my back. Cheryl McNutt has pointed that out. So there's some incentive to not be sitting so long. And sitting rather than standing does seem to play a bit of a bad influence on people's backs and their health. That's why these stand-sit workstations are becoming so popular. Some of you may have seen a video of Dr. Gwain and myself talking about risk of breast cancer with oral contraceptives, and you might see behind me there's a stand-sit desk, because that's what I use at work now. Dr. Gwain is here. Just got back from a run. Can I sit now? That's the question. That's what we're talking about. So if you go to Medical News Today, it's medicalnewstoday.com, and find their article that came out today titled "Too Much Sitting Doesn't Cause Weight Gain," says study. And you'll be able to find the article by Honor Whiteman on this. And actually, I'd love to have a discussion with Honor Whiteman on this exact topic, because she's writing about it, and of course writing about the other health risks associated with sitting too long. And talk to her. I'd really like to talk to her about this discrepancy in the article she's writing on between the results and the conclusion. And just to review it real quickly for Dr. Gwain, the actual article in Sports Medicine, which just came out November 30th, they have the statement saying there's an odds ratio of becoming overweight or obese, overweight or obese of 1.33, odds ratio 1.33, the 95% confidence interval is 1.11 to 1.60, so there's both positive, the greater than 1, with a p-value of 0.001, which I think that's, what, 1 in 100 chance of that being random? Anyway, the odds ratio of becoming overweight was 1.33, and the highest compared with lowest categories of sedentary behavior. So a positive correlation on the odds ratio of being overweight or obese with sedentary behavior. But yet the conclusion, get this, the conclusion says, meta-analysis of data from prospective cohort studies showed small, inconsistent, and non-significant associations between sedentary behavior and body weight. So they're really, really downplaying that result. And then the article is produced or published in Medical News Today that says the study says there isn't correlation. But you can see there that there is. So Dr. Gwain is being very gracious and saying hello to everybody. And Angela says, exercise always made me feel much better sitting at a desk job with my posture, breathing, and stress management. Pamela Schramke, I love a standing desk and being able to choose if and when I sit. I spend at least half my day standing. Good for you, Pamela. And you guys encourage Dr. Gawain to stand. He probably does quite a bit. You know, we're going and seeing the patients. We're always up and moving around. It's just when we're sitting down, we're sitting with patients. I always sit with the patients in the room. We're taught to do that. Patients get the perception that you're spending more quality time with them when you're sitting with them than if you stand. There's studies to show that. And that's important in patients' health. Their perception is a part of their health, so that's why we do that. And Dr. Gawain says, what about a workout ball? We actually have a couple of workout balls in the office that people sit on that are in a little structure that has a seat back to it. And my understanding is that they are better for posture. I don't know for sure. I just know that's what all the hype is about them. BooBoo points out, I have to balance the time between standing and walking and setting. What are you setting? Setting the table? My back hurts after prolonged periods of either. Keep moving between them. Keep alternating. Keep moving from sitting to standing to moving. Not being in one specific thing too long. We really don't want people to sit too long. People with back pain, people who come in with acute back pain, we want them not to be still, not to be sedentary. We want them moving. They say, oh, it hurts when I move. Yeah, well, yeah, it will, but in the long run, you're going to be better because people get so stiff when they have acute low back pain come up, just regular old musculoskeletal pain, the most common type that we come across, and they do so much better when they're moving. When I had my back pain this fall for 2 months straight, finally, anti-inflammatories helped, but also regularly moving. It was when I was much more regular about continuing my running, even though I had a sore back, that I was doing better. In fact, the only time I was pain-free was when I was running. So keep moving. Gentle motion, which is walking, essentially. All right. And you guys are having your conversation back and forth, which is good. We're glad that we can provide community for you. Don't have a pre-produced video for tomorrow, but who knows, something live may come up. We're actually working a little bit on spiffing up the office to make it look a little bit better if we can do that. Oh, Sharon Calvert says we go back to common sense. I don't know. Is it common sense to think that moving when it hurts to move is going to make your back better rather than resting it? I don't know that that's common sense. I think commonly people would sense something opposite of that. Brianna says that she has scoliosis and doing either hurts her back. I'd move constantly because she has 3 babies, but it really hurts. And Butterfly says my posture is really bad and my back has been bothering me too. I'm assuming that my weight is part of the problem. Being overweight does work to your disadvantage because it causes more stress on the lumbar discs. There's more for them to have to do. And we have seen from studies on people's discs to see how much pressure they're experiencing. As weird as it may be, there's more pressure on the disc normally when people are sitting than when they're standing. Would not necessarily think that's the case, but it's just the way the weight is distributed. You want to be standing to be better to your back and to give it more of a break. Okay. Also, okay, Lindsay, I want my knees to feel like they have some cartilage in them. Thank you so much, everybody, for being a part of this. Thank you, patrons, Lindsay, Antoine, and BooBoo Kitty, who are here right now. And, oh, also, we have Petra Rosenberg here, too. So all 3 of my patrons at the top level, or top levels, I should say, are here. Thank you, ladies, and all you do to help make this keep going. You guys are a big part of it. The other patrons are also people like, I saw John Baugh earlier, who also is one of our patrons. And if I don't recognize that you're one of my patrons, I apologize if you're up there. Until next time, Dr. Mark Vaughan telling all of you to stay in good health.